Do you have a sweet tooth? Can we reverse cavities? Yes, we can. This is Dr. Radwa Saad, and join me in this new episode of the Wonder Tooth Podcast to talk about tooth decay and how we can fix it at home without actually getting treatment done. First of all, make sure you subscribe, follow, and share this channel. And also for complimentary consultation, make sure you use code DENT40, DENT40 for a complimentary consultation for a smile fixation, dental teeth whitening, or even dental implants. My name is Dr. Radwa Saad, and I am a practicing dentist in the US as well as in Canada. I've done it all. I've over 20 years of dental experience. I have a master's degree in implant placement and restoration, and I've done tons of implant, tons of smile makeover, and I love to educate people. At this point, it's fun. And if you need any work done, make sure you shoot me a little comment down below here. My office is in Princeton, New Jersey, and we are the best, basically. So let's talk about teeth. What's going on? What's about tooth decay? Did you guys know that the tooth decay is actually number one common disease in the world, in the whole entire world? Among number one, before heart disease, before cancer, number one disease in the world is untreated dental decay. So what's going on? First of all, let me explain to you something very unique. The tooth is a very unique structure compared to the rest of your body. The enamel that's covering that tooth part on the top is actually much stronger than your bones. Can you believe that? So under that nice strong shell comes the dentin, which is inside of it. And inside of the dentin comes the nerve, the pulp. We call it the pulp. It's a very unique structure. And the tooth comes with the little entourage, which is the periodontium, which basically involves the bone that's holding that tooth in its place. And then there is a little ligament that's holding that tooth into the place. And then the gums that's covering everything. It's a very unique structure. And I have to tell everybody, you really have to treat your tooth and your teeth in general with respect, because they are basically the opening to a lot of problems afterwards. So make sure you check them, get them cleaned regularly. And first of all, let's talk about tooth decay. Why do we get decay? Why there is, why it's number one untreated dental cavities, it's number one disease. It's because of the strep mutans. What is that? Oh my God, she's talking crazy stuff now. Well, you have tons of bacteria that lives inside your mouth. Tons of them. The very common one is called strep mutans. It's a strep. It's like strep, but it's a different brand. And this is particularly the cause of dental decay. Can we get rid of that strep mutans? We can't, unfortunately. It lives in your mouth. So what do? We should stop feeding it. Stop feeding the bacteria in your mouth. That's like number one rule. And how do we do that? Well, before I say it, we need to brush every day, 2 minutes, twice a day, 2 minutes in the morning, 2 minutes at night. Did you guys know that the average human, if you are really good and you're brushing your teeth, you're literally brushing 48 seconds, 48, not 2 minutes. We need 120 seconds, guys. You're giving me 48 seconds. That's not enough. Okay, we need to brush 2 minutes. And how do we do this? Maybe get like a little alarm or something, something to kind of remind you. And I always say, do each quadrant 30 second count in your head, 30 seconds here, 30 here, 30 here, and 30 here. And of course, make sure you clean the inside of your teeth too, and on the biting surface as well. And this is how you get your 2 minutes. So number one big problem is poor oral hygiene. We are not brushing our teeth long enough. So what happens then? The bacteria kind of sits, okay, they're feeding us. Okay, what do? We are secreting acid and enzymes. So two things are going to happen now with the acid and enzymes. One, gum inflammation, which could be gingivitis, like early stages, or it can get deeper in those nice little ligaments that's holding the tooth. Okay, now I have a pocket. And what does the pocket means? Literally, it's a pocket. So the ligament that's holding the tooth in place, it starts to detach. And now we have a little tiny gap. This is the root, and this is the bone. And now we have a little gap in here, and that's a pocket where food and bacteria gets inside here, eat more, and then, okay, now we have gum infection and we have gum disease, and this is irreversible. So how do we stop this? Basically, brush 2 minutes and floss. Use the string. And I'm gonna show you in another episode how to actually floss and brush your teeth really, really properly like a pro. Okay, number 1, poor oral hygiene. What else? Dry mouth. If you have xerostomia, dry mouth, you are taking certain medications that can cause that. If you have diabetes, it can cause that. So you are at a higher risk now. Or if you have GERD, like acid reflux also can cause that. And some of the autoimmune disease can cause dry mouth as well. And also if you're not drinking enough water. Oh, I forget to drink water, or you're just drinking soda and a lot of like sugary intake, that doesn't count. You need to drink actual water, bottled water, tap water, some water, okay? Normal water, no additives, no vitamin water, just water, plain water, okay? Why is that? Because it kind of stimulates, the tissues. It lubricates your tissues. So rather than have like really, really dry mouth inside, sometimes when I'm actually checking the patients, my mirror gets stuck to their cheek, and I'm like, what? Make sure you drink plenty of water. And if you are taking some certain medications, you might want to ask your medical doctor. Do not stop the medications, just ask your medical doctor if they can give you something else with less side effects. Okay, now what else? Acidic foods and drinks. And what is that? It's anything other than water, okay? Anything has acid. Coffee has acid in it. Tea has acid in it. Anything that's not water, it's considered acidic, okay? Maybe milk just has a little bit more alkalinity in it, but really anything that's not water, you really need to rinse afterwards. Fruits are good. I love fruits, but you still have to rinse afterwards, please. Okay, and especially if you're wearing aligners, that's a big thing. You really have to brush after every meal. Any snacks, you have to really brush or at least rinse really well before you put your aligners back on. So now we understand the big number 1 is poor oral hygiene. Number 2 is if you have dry mouth. And number 3 is if you are doing a lot of drinking a lot of acidic or sugary intakes, a lot of soda and Coke, and all of this can cause, cavities. And what else? Well, of course, if you don't go to your dentist or get your teeth cleaned or get your teeth checked, how do we do that? Well, of course, you have to go to the dentist. They're going to check your teeth, make sure, with that tiny little, we call it the tooth counter, the tiny little sharp thing. They basically have to go and check on the surface of the tooth. So how do we check the surface of the tooth, especially between the teeth? So we check the biting surface, we check the outer surface, which is here, and then the inside surface with that little tool. Make sure nothing is sticky, okay? If something is sticky, that means we have a cavity. Of course, if you feel there is a hole in your mouth, 100% that's a cavity. Now, how can we check between the teeth? We have to take an x-ray. And why is that? Because we don't have x-rays in our eyes as dentists. X-rays are actually very safe. I really have to emphasize that. As a dentist, we cannot diagnose your oral, your oral health. We cannot diagnose if we don't have an x-ray. And I know some patients are, scared and reluctant and I don't want an x-ray. I understand that, but that's basically, it equals a trip from here going somewhere else. That trip, that's a little radiation. Okay, and in our offices now, pretty much everybody's using digital dentistry, and it's very minimal x-rays. It's literally like sitting in the sun for 15 minutes. Don't you guys sit in the sun for 15 minutes? You do. So, and we also put like all those, lead apron and cover your, your thyroid. It's pretty safe, but we need to see between your teeth, and how can we see that with a little x-ray? So now we know the causes of basically a cavity. It's the strep mutans. You have to write it in the comments below. Strep mutans. I just want to know, I want to make sure that you guys are really learning something. Mutants, like the turtle, okay? The ninja turtles. Okay. Now, how can we actually fix those dental cavities without a restoration? How can we do that? Remember when I said we need to take a lot of x-ray? Now, the enamel is the outer layer of the top part of the tooth, and inside is the dentin. And there is a very thin line between them, and it's called the dentino-enamel junction. What does that mean? It's coming from the dent and going to the enamel, dentino-enamel junction. So let's say you didn't floss for a little bit and we start to see something very small, grayish on the x-ray on that outer layer, which is the enamel. So this is basically a D1 classification of a cavity. Now, for the cavity, we have a certain classification for caries, okay? If it's still in the outer layer of the enamel, still did not reach that little line that separates between dentin and enamel, it's still a cavity that can be reversed. Yes, we can reverse cavities. And how do we do that? Remember in your saliva, remember I said your saliva is literally your first line of defense. You have minerals in your saliva. So as long as, next to the bacteria, next to the strep mutans, we still have minerals. So if you keep that area super clean, basically brush twice a day, floss, and use some fluoride treatment. And I know some people are totally against fluoride. We don't want fluoride, but listen guys, it's very well researched. Fluoride can reverse cavities, especially if it's still in the outer layer of it can remineralize it back. How do we do that? Because basically it bonds to the tooth surface. The fluoride, it bonds to the tooth surface, and the enamel itself is made of what we call hydroxyapatite crystals. And now the fluoride attached to it, and it becomes fluoroapatite. It's much more resistant to cavities. And with some minerals, it can actually remineralize that area again. But of course, if you don't floss and be like, oh, I'm good, my immune system is amazing, it's never gonna mineralize. So make sure if it's still very small and in the outer surface of the enamel, it did not cross that line yet, so we are still good. We can literally reverse that by flossing really well, brushing really well, and get some fluoride. The best time to get it actually done is when you go to the dentist and basically you get a cleaning and your teeth, are clean. There is no biofilm on it. And the biofilm, it starts to happen like around 30 minutes to an hour after the cleaning is done. And it's like a like a thick layer. It kind of sticks, and it's basically made of bacteria. It's made of bacteria and remnants from the plaque, and it just sits there. How come? And I just had my cleaning done. That's your teeth. That's the that's the nature of the teeth. Okay, we have to get that fluoride placed, and it's a little sticky because then it sticks to the teeth before that biofilm is formed, and it basically makes the teeth more resistant to cavities. Okay, we can still reverse the cavities if it's still in the outer layer of the teeth. Now, let's say it actually got closer now to the line. As long as it didn't cross that line, the dentino-enamel junction, we're still okay. We can still fix it. And this is when sometimes you go to the dentist and be like the dentist, I'm gonna monitor that tooth, I'm gonna monitor that tooth. And this is what I do. I usually say, I'm gonna monitor that tooth, and I'll tell the patient, you see that tooth, the second from the back, you need to floss really well. And they're like, what happens? And I show them on the x-ray, this is what's going on. And if we don't really clean it well, we are still at the early stages, it can remineralize back. There are certain also toothpaste. You can ask your your dentist, you can ask your dentist about certain toothpaste that can help in remineralization of the teeth too. Some of them, they have more minerals, some of them have more fluoride, but it helps really well with, prevention, and as well as reversing those cavities too. Okay, now let's say that cavity, now that line, that gray, it looks literally like a little triangle. If that kind of crossed that line, that's a cavity. This is when, okay, that's a cavity, we have to fix it. So now we understand there is a classification. Now let's say that line already, it was crossed, so it's a filling. Sometimes it's a small filling. If it starts to become deeper, and you remember there is a little nerve in the middle, then we're getting closer to the nerve. That's gonna be a deep cavity. This is when problems start to happen. If you let it untreated because I'm scared, I don't want to go to the dentist, I understand that. But if it gets all the way now to the nerve, that's a root canal, and this is when you feel that severe pain that nobody really likes to talk about. How can we also prevent, cavities? So brushing, flossing really well every day. keep your mouth hydrated, drink plenty of water, some fluoride treatment, or even toothpaste with fluoride. Use that. Fluoridated water. So if you're drinking tap water, most of the, the towns or the cities, most of them, they have fluoridated water. If you're drinking bottled water, so most likely there is no fluoride. So you have to make sure you get some fluoride too. Actually, tea has fluoride in it. So if you like to drink tea, that's good. But of course, tea has acid, it has tannic acid in it. So make sure you kind of rinse afterwards, because also it can stain your teeth. So if you're really looking for natural fluoride. Sealants is a very good alternative too. So what is a sealant? Sealants usually are done, and we recommend sealants to be done for the kids. Pretty much older molars, the permanent teeth, the 6-year-old molar, you should start to put sealants on them. And what is that? So it's a very thin layer of resin. How do we do that? Basically, we clean that tooth, we brush it really well, like, not like at home. We clean it really well. Then we put a little bit of like bond that gets on the biting surface of the tooth. There are very thin grooves. So those grooves, if something gets stuck inside, cavities can start to happen. You cannot do that at home, unfortunately. You have to brush well, but if the groove is really deep, you have no say over this. So what we can do is we basically seal them. So we put some bond that's gonna go inside, and then we put a very thin layer of resin that's gonna basically seal that biting surface. Sometimes you can see it as like a really white thing that's like in the groove, rather than having like dark groove, or black grooves. You can see like something whitish. Or basically, when you go to the dentist, remember that little sharp with the tooth counter, we just make sure there is nothing sticky inside. Okay? So that's the episode today about teeth and the tooth decay and how we can prevent that. And if you have any questions or if you have any comments, make sure you put them below here, and I'll be more than happy to discuss, if you have any dental questions for me, or if you have had any dental experiences that you want to share with all of us. I'll be more than happy to answer, and I'll see you next time. Don't forget to take care of your teeth so that they can take care of you.